Imagine a child living in a remote village who has never seen a doctor. Imagine that same child getting sick from something completely preventable. Not because medicine doesn't exist, but because healthcare never reached them. Now imagine that you are the reason it finally does. According to the World Bank, about 4.5 billion people around the world still don't have full access to essential health services, and nearly 2 billion people struggle financially because of healthcare costs. That's not a small issue, that's a global health crisis. By the end of this speech, you will understand why joining a Medlife movement service learning trip can truly change lives and why your involvement matters. We're all here because we care about our futures. Many of us are future healthcare professionals, future leaders, future advocates. This is a chance to be part of something bigger than ourselves. Now, today I'm going to walk you through 3 things. First, I'll address common misconceptions about service learning trips. Second, I'll show you real data that reveals the reality of global health inequality and Medlife's measurable impact. And finally, I'll share a real story about a real patient that shows what happens when healthcare is missing and what changes when access is restored. Now that you know what we'll cover, let's start by clearing up some common misconceptions. Misconception number 1 is that service learning trips don't make a measurable impact. But in reality, according to Medlife's official 2023 year in review, volunteers supported over 171,000 appointments, such as medical, dental, educational, and women's health appointments in just 1 year. That includes preventive screenings like pap smears and breast exams, which help detect diseases early on and save lives. That is measurable, that is documented, and that is a real impact. Misconception number 2 is that it's just a short-term charity. But Medlife focuses on sustainability. In 2023, Medlife completed 31 sustainable development projects, impacting about 3,500 community members. This project includes improving access to clean water, strengthening infrastructures, and building long-term community programs designed with the community in mind. That's not temporary help, that's long-term change. Misconception number 3 is that students don't actually contribute to a meaningful way. In reality, students work alongside licensed healthcare professionals. They assist with patient intake, organizing pharmacy supplies, leading health education workshops, and helping with translation. They're not just standing there watching, they're part of a structured, supervised system that helps clinics run efficiently and serve more patients. So now that we've cleared up the common misconceptions, let's zoom out and look at the bigger picture. On this slide, you see Medlife's 2023 impact. Over 171,000 appointments were delivered and over 3,500 development beneficiaries and hundreds of volunteers serving cities like Rio Bata, Tina, and Lima. These numbers come directly from the Medlife 2023 year review. This graph shows something important. In just 1 year, tens of thousands of people received healthcare access they may have never had otherwise. Now, let's connect this to global inequality. The World Bank reports that 4.5 billion people lacked full coverage of essential health services. So when you compare that global need to 171,000 appointments delivered in just a single year, you begin to see that these trips are not symbolic. They are organized, they are structured, and they are measurable responses to inequality. The data is powerful, but numbers can only tell part of the story. Now, I want to show you the human side. According to the World Health Organization, nearly 800 women die every single day from preventable pregnancy-related causes, most in low-resource settings. That's 800 mothers, 800 families, and every single day without access to healthcare. Preventable maternal deaths continue. Children die from treatable infections like pneumonia and diarrhea. Chronic illnesses go undiagnosed. Cancer screenings never happen, and conditions get worse. Let me share a patient story. Medlife shares the story of a patient in a remote community who developed a tumor behind their eye. It caused constant pain, it threatened their vision, it threatened their ability to work. They did not have the money or access to see a specialist. But through Medlife's follow-up program, they were connected to an eye surgeon and received a surgery. Their vision improved, their pain was relieved, their life changed. Without access, that story could have ended in a permanent visual loss. With access, it ended in recovery. Sometimes the difference between disability and healing is simply access. So now that you've seen the reality, I'm asking you to be part of the solution. Today, we talked about how billions of people still lack healthcare access. We saw how Medlife helped deliver over 171,000 appointments in just 1 year to families who struggle with basic healthcare needs. And we learned that without innovation, preventable deaths continue every single day. Change is possible, but only when people step forward. So now I want to ask you something serious. How many of you would be willing to commit to participating in a Medlife service learning trip this year? And if that feels a little big, how many of you would be willing to attend an informational session or join a fundraiser? Because the difference between someone suffering and someone receiving care could be just you showing up. Thank you.